Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome to episode number 3 and part 2 of our estrogen discussion. In part 1, I talked a lot about what the loss of estrogen could do and could feel like in a woman's body. Today, let's talk about what happens if a woman or a man has too much estrogen and what it could do to their bodies. Let's start with the ladies, and gentlemen, please stay tuned throughout this, as I will also talk about high estrogen in men and its serious dangers. But if you have a mother, a sister, a girlfriend, a partner, a wife, this will help you understand what they might go through when they have high estrogen and what they might experience. And when I describe some of the symptoms, you might be like, oh, wow, yeah, that's what's happening. Believe me, you will be a better partner, relative, or friend if you understand what is happening and how estrogen can wreak havoc on a woman's body if it's not balanced right. You might have heard or read somewhere about estrogen dominance, or you might be completely clueless as to what estrogen dominance is. Well, as the name indicates, estrogen is a dominant hormone, which is not an ideal situation in a woman's body because you want hormones balanced well. So if you don't understand, don't know exactly what it is, you're not alone, but it's very simple. Estrogen dominance means there's too much estrogen in the body. So before we talk about how that happens and what's causing it, let's first talk about how it feels in the body, what the symptoms are, and towards the end, before I explain the bad consequences with high estrogen in men, I will also discuss the estrogen dominance and relationship between estrogen and progesterone. So what does a woman feel when she has too much estrogen? Too much estrogen for a woman can lead to weight gain around the midsection and around the hips. It might also cause breast enlargement. Having too much estrogen would lead to changes in a woman's periods. They become heavier, longer, and crampier than usual. Having too much estrogen can lead to severe or worsening PMS, premenstrual syndrome. Having too much estrogen can lead to depression, anxiety, and sleeping difficulties. So, to keep it simple, if you're a woman or you know a woman who has been pregnant, that's pretty much about the same thing. You have sore breasts, you have cravings, you gain weight, you become irritable, scattered, and will have trouble concentrating, might also have trouble sleeping. And none of this sounds good. No one wants that. More importantly, persistent excess estrogen level can lead to recurrent vaginal infections, especially yeast infections. And it can also lead to disease, or another fancy term for disease in medical world is pathology. For example, fibroid formation in the uterus, benign solid tumors that cause bleeding and pain. It can lead to uterine polyps. Those usually grow inside the uterine lining. It can lead to fibrocystic breasts, breast lumps, ovarian cysts, possibly endometriosis, and worst of all, could possibly increase risk for cancer down the line later in life. So let's talk about the gentleman a little bit. Hello, gentlemen listeners, if you're there. What does a man feel like when he has too much estrogen? And if there are no gentlemen listeners, that's okay. Lots of women listening probably have a man in their life, and they should know what this feels like. First and foremost, having high estrogen can lead to low sex drive and erectile dysfunction, which means erections are harder to achieve and are more difficult to maintain. Having too much estrogen in a man can lead to infertility and problems with sperm quality and sperm quantity. Having too much estrogen for a man can cause an increase in breast tissue or man boobs. The fancy term for that is gynecomastia. And too much estrogen in a man will lead to weight gain, a decrease in muscle mass and tone in spite of regular exercise, and it can cause stubborn belly fat and significant fatigue. More so, if a man has too much estrogen, he can become depressed, more emotional, and much more prone to mood swings, kind of like a woman. So we talked about the signs and symptoms of high estrogen in men and women, and how do we know if there's too much estrogen in the body? So the next question is, how does this happen? Well, there are a few ways we accumulate more estrogen than we actually need. Number one, our body produces excess estrogen. Number two, our body cannot eliminate the estrogen that is produced in a normal amount, or it's added to the body. And number three, our body is exposed to hormone disruptors. Let's talk about number one, when our body produces more estrogen than it needs. Well, how can this happen? Most likely, there might be an estrogen-producing tumor that's usually in the ovary or the adrenal gland for a woman or the adrenal gland for a man. Thankfully, this is a very rare situation, 1 to 2 in a million. A much more common situation when our body has more estrogen than it needs by producing it is when we have a high percentage of body fat. And that is true for both men and women. Both men and women convert androgenic hormones like testosterone into estrogen, specifically in the fat cells. This is a process called aromatization of the testosterone. More on this later in this podcast. This specific process, the conversion of testosterone to estrogen, will lead to increased levels of estrogen. And the more fat we have, the more circulating estrogen we will have. Another common situation when we have high estrogen is due to stress. Our body, when stressed, will produce excess cortisol. So the increased level of cortisol does two things. Number one, it contributes to excess fat deposits on the belly, which increases the aromatization of testosterone into estrogen. And it will also decrease the body's ability to produce the progesterone needed to balance a woman's estrogen. And more on the estrogen-progesterone balance in a little bit. One of the most common situations, and we're probably all guilty of it, and it's much more common than you think, drinking alcohol daily can raise estrogen levels. Alcohol has to be metabolized by the liver, and this is exactly where estrogen is being metabolized. This creates a competition between the two, with alcohol always winning. The body knows you need alcohol processed and out of your system by the next day, because in the short term, that's much more important than dealing with excess estrogen. So excess estrogen will always be put on the back burner and will not be metabolized properly, and it will circulate around, causing problems. So these are most of the ways in which the body ends up producing or circulating higher estrogen levels. A tumor, high percentage of body fat, too much stress, and too much alcohol. Let's talk about number two. Our body cannot eliminate the estrogen produced naturally or add it into the body as estrogen therapy. Estrogen needs to be metabolized or processed by the liver. This is our detoxifying powerhouse, where estrogen is broken down into water-soluble molecules eliminated by our intestine or kidneys. All the estrogen that is being made in our bodies or introduced in the form of replacement or birth control pill needs to be eliminated daily. If the estrogen is being replaced because a woman suffers from loss of estrogen symptoms or a birth control pill for birth control, the estrogen will have to be processed and eliminated just like it did when the body was making it naturally. Let's talk for a second about estrogen metabolism, the process through which the estrogen is changed into products that are able to be eliminated. Estrogen will have to be hydroxylated into the liver, that's called phase 1 detoxification, and will then be subjected to a process called methylation and glucuronidation called phase 2 detoxification. And this is the main pathway that allows estrogen to be eliminated from the body. In order for us to have a healthy estrogen metabolism, we need a very healthy liver. The liver is absolutely needed to be completely functional in order for this estrogen transformation process to happen as it should. And we also need another thing, an intact, functioning intestinal lining with normal friendly bacteria, because estrogen needs to be eliminated through the stool once it's been processed. Let's talk about step 1 of the detoxification process. What happens if our liver does not work well? For example, many overweight men and women do not metabolize estrogen properly because they likely suffer from fatty liver. We know at least 50%, if not more, of the estrogen biotransformation into products that can be eliminated happens in the liver. So anything that interferes with the liver, for example, excess alcohol, excess fatty foods, excess refined sugar, high fructose corn syrup, viruses, medications, or weight loss supplements will interfere with the liver's ability to detoxify you of hormones, specifically estrogen. Well, let's talk about step 2 of the detoxification process. What happens if the intestine is not working well? So we cannot poop out estrogen. What happens if estrogen cannot be eliminated? And why that happens? That is usually the case when our microbiome has been hijacked by bad bacteria. So we don't have a lot of the good bacteria, and that has been replaced with bad bacteria. This type of bacteria can actually produce an enzyme called glucuronidase. This enzyme specifically breaks down the estrogen that has been processed by the liver through the process of glucuronidation, which means it simply gets a glucuronate molecule attached to it to make it elimination and poop ready. Once this link is broken down by the enzyme I mentioned before, the free estrogen gets reabsorbed. The body says, oh, this is a bioidentical natural hormone. It cannot be in the gut. So it reabsorbs it right back into the circulation. The body will not be able to get rid of it at the rate necessary to keep a good balance and a good harmony in the body. Keep in mind, there is a very specific supplement that inhibits this bacterial enzyme. This is called calcium deglucarate. It has nothing to do with calcium supplementation. And again, this is called calcium deglucarate. Ask your doctor if he or she has heard of it and what dose might be needed. How do you know if you have these bad bacteria making this excess glucuronidase enzyme? There are labs running a fecal glucuronidase test. Some of the tests have not been validated in the sense that there's no standardization. So it's not very clear to modern medicine world whether the high positivity results correlate with something actionable other than so-called anxiety provoking. And this is the view of many conventional medicine doctors. The functional medicine doctors and naturopaths consider that this test correlates with high estrogen levels, and they recommend supplements, like I mentioned before, when this test is positive. Also, keep in mind, this type of testing is highly unlikely will be covered by your insurance company. So if you are or have been on estrogen replacement therapy or birth control pill, and you wonder why you cannot tolerate it, it's because you likely have trouble eliminating it, and it keeps accumulating, causing problems, maybe giving you anxiety and palpitations and mood issues. Let's talk about number 3, when our body is exposed to estrogen disruptors. So number 1, we make and have too much circulating. Number 2, we can't eliminate it. So the elimination process is defective. And number 3, there's a receptor problem. Remember in the previous podcast, I told you to remember this word receptor. The hormones act on the cells like a key and lock mechanism. The hormone combines with a specific receptor for that hormone to activate cellular change and cellular action. Obviously, the estrogen disruptor situation can be a topic in and of itself. There's lots to talk about, so we could talk about these for 30 minutes. But for now, let's just clarify what these disruptors are. They're also called estrogen-like endocrine disrupting chemicals, also known as EEDCs. These are man-made chemicals that alter the function of our endocrine hormonal system. These chemical substances interfere with the process of production, metabolism, binding of the estrogen receptors, and interfere with the cellular response to the natural estrogen. These estrogen disruptors are found in various plastic products, pesticides, flame retardants, and many other products we need and use daily. Skincare, fragrances, many children's products, food storage materials, plastic containers, many industrial solvents or lubricants, and their byproducts. Some of these endocrine disrupting chemicals are found abundantly in our environment. DDT, PCBs, BPA. In case you didn't know, BPA's toxic effects are very well known and highly publicized. BPA is found in the lining of canned foods, in the polycarbonate hard plastics, even on the register receipts we get from restaurants and from stores. BPA has been linked to causing hormone-related breast and prostate cancer, polycystic ovary syndrome, and early puberty. United States uses over 85,000 manufactured chemicals that are currently in use in everyday products and throughout our environment. So far, the consumer, which is all of us, has no protection because no one has made it illegal for these companies to put toxic ingredients in their products. We are at their mercy. Best we can do is read the labels. If you see a name, you don't understand it, you don't want to Google it, maybe pass on the purchase. So what can we do to minimize estrogen disruptor issues? There are a few things I can think of. Keeping our hands clean throughout the day by using non-fragrant soap and water, cleaning our house regularly. We all have abundant flame retardant chemicals in the household. From the carpets, from the furniture, they accumulate in the dust and the floors. Avoid plastic at all costs, which might be hard. We are surrounded by plastic, especially water bottles. Consider using stainless steel bottles, filtered water. Keep in mind our tap water is not safe to drink or necessarily to cook with. It can contain a lot of potential hormone disruptors and toxic chemicals, including residue from birth control pills. Eat organic as often as you can. Consider home cooking versus eating out regularly. And please know that there are estrogen disruptors in the non-stick pots and pans, so consider using cast iron or stainless steel. Back to the estrogen dominance I mentioned earlier. How did this term come to be? Well, in the medical world, when we use the term estrogen dominance, we refer to the fact that estrogen is not balanced appropriately by the progesterone. So estrogen and progesterone are a team. They work in tandem. They work together. So they need to be side by side. One without the other does not work well. So when we refer to estrogen dominance, again, we mean estrogen is not balanced appropriately by progesterone. So the levels of estrogen are too high for the amount of progesterone that exists in the body. So we can develop estrogen dominance as a woman in three circumstances. When we have low estrogen but no progesterone, when we have normal estrogen but no progesterone or low progesterone, and when we have high estrogen and normal, low, or no progesterone. How does conventional medicine address estrogen imbalance? Well, the answer is very simple, and you probably know it because you've probably been to a doctor and have been offered this solution before. 90% or more of OBGYNs will likely resort to offer a woman as first-line therapy for all her symptoms related from estrogen dominance, a birth control pill. That is not necessarily wrong or bad as far as logic and reason and causality goes, and let me explain why. The reason many female conditions like fibroids, heavy bleeding, endometriosis, and pelvic pain, ovarian cysts are being treated with birth control pills is because the birth control pills effectively stop your own estrogen from being produced. By taking a low-dose, synthetic fake estrogen pill, your body is tricked to think it has enough estrogen. So the mechanism that allows your ovaries to continue to work and make estrogen on a daily basis stops dead in its tracks. Your follicular stimulant hormone, you might remember I mentioned this earlier in the first podcast, FSH, made by the pituitary gland, is suppressed by the taking of the birth control pill. And without FSH, which is the regulatory control from the pituitary to the ovary, your ovary will not produce any hormones at all. No estrogen, so no progesterone and no testosterone. You will continue to have periods when you take the birth control pill because the estrogen from the pill will continue to create your lining to grow inside the uterus, and usually that sheds on the day when you take the placebo pill, when there's no more hormone. However, remember, when you take a birth control pill, your own estrogen is gone, is not being produced, and the tissues that are relying on your own estrogen might not like the birth control pill and might start to be affected and shrink in a sense. That's actually very good for ovarian cysts. We don't want the FSH hormone to keep bombarding the ovary to make more cysts, so we want to literally stop that and give the body a chance to let the cyst resolve on its own. That is why many physicians will probably advocate for birth control pills to speed up the healing of an ovarian cyst, or to help with bleeding from hormones that are too high, or to help with endometriosis, or to help regulate periods. It is a very easy fix. Most physicians use it, and unfortunately, most physicians, that's all they know. However, the reason why we're having this podcast, what I'd like for you to know, is that the key to having a good hormone balance and not needing a birth control pill as a treatment is a healthy estrogen balanced by a normal, healthy progesterone level. So let's talk about that for a second. What do we need to get that healthy progesterone level that's required to balance estrogen? There are a few things that are absolutely necessary for estrogen and progesterone to be naturally balanced and in harmony. Number one, you have to have a normal functioning ovary, and you need to ovulate every month on a regular basis. For that, you need to have a healthy ovarian reserve and be at an age where you make good quality eggs, which means the luteal phase, the second phase of the ovarian cycle, is adequate. And your ovary will produce enough progesterone to balance the estrogen. More on this in the podcast about progesterone, which is next week. If your ovaries do not function well because they are aging or because they're dysfunctional, and you are not making enough progesterone to balance your estrogen, or you're not ovulating, which means you're not making any progesterone at all, it would seem logical that a physician would first discuss and offer progesterone replacement and support. You might not know, but Big Pharma makes micronized progesterone, which is bioidentical, and it comes in 100 and 200 milligrams. Progesterone can also be compounded at compounding pharmacies if you have a peanut allergy or if you don't like the synthetic ingredients present in the micronized progesterone. So number one, we have to have a normal functioning ovary, and there's got to be ovulation on a regular basis for progesterone to be produced. Number two, we need to have a healthy adrenal with a normal stress response without excess cortisol release. Excess cortisol is bad, leads to excess fat, leads to excess estrogen, which unfortunately inhibits ovulation. So not only do you have too much estrogen, but you won't ovulate and you don't have any progesterone. So it's a bad situation. Stress is not good. And number three, we must have a healthy estrogen metabolism and elimination system. That means we need to have good intestinal health. And again, remember the key to a healthy estrogen elimination might be gut health. As I mentioned earlier, the estrogen needs to be eliminated by the gut. This is as important after menopause when we replace estrogen as it is when you're younger and you make your own estrogen. If your intestinal health suffers changes and you have certain types of bacteria that make these large amounts of glucuronidase enzyme, This enzyme will break apart the processed and metabolized estrogen, freeing it and causing it to be reabsorbed into your bloodstream, effectively interrupting the estrogen elimination process and creating estrogen dominance. Many women suffer from SIBO, and many women have no idea what SIBO is. That is, SIBO stands for small intestinal bacterial overgrowth. It's a very frequently undiagnosed condition that causes severe bloating. You eat food, and it might be great, healthy food, or it might be really bad food. It doesn't matter. Suddenly, your belly gets big like you're pregnant, and it hurts, and you wonder what's wrong. Talk to your physician about SIBO. SIBO can drive or worsen endometriosis, severe menstrual cramps called dysmenorrhea, heavy, clotty periods, PMS, and possibly PCOS, polycystic ovarian syndrome. There is significant proof that bad bacteria could lead to many hormonal problems. So when you're faced with an estrogen imbalance, please consider intestinal health evaluation and treatment as a possible way to restore that balance back to normal. I mentioned earlier there are natural supplements like calcium D-glucarate and DIM, D-indole that are easily available over the counter. They can help mitigate these estrogen dominant symptoms. Eastern medicine looks at hormones differently, addresses hormone imbalance very effectively. With acupuncture and Chinese herbs, they work on realigning our qi. Consider seeing a functional medicine doctor that is likely not going to accept your insurance, but will give you important advice tools and diet recommendations and possibly supplements to help you manage your gut health problems that are likely causing your hormonal issues. More on the hormone and gut connection in the future. Let's talk a little bit about estrogen in men. It is true that the male body needs a small amount of estrogen to function properly, but significantly elevated estrogen levels will cause serious health problems like gynecomastia, an enlarged breast tissue, or erectile dysfunction, weight gain, increased risk of depression, feelings of fatigue, low muscle mass, and infertility. Why would men develop higher than normal estrogen level? Well, there's a couple of circumstances, and let's go through them one by one. A very simple and very obvious reason is actually a poor diet. Increased carbohydrate intake will increase body fat. Body fat cells in men and women contain an enzyme called aromatase. Testosterone in men and also in women can be converted to estrogen. So again, testosterone goes into estrogen. And that specifically happens in our fat cells under the influence of this enzyme called aromatase. Maybe you knew that, but most people don't know that. Many men that come into the practice are unfamiliar with estrogen in men and why aromatization of testosterone into estrogen is not healthy. So indulge me for a little while I explain this. This is a very important biochemical process through which testosterone is converted into estrogen. However, when enhanced or overexpressed, it will lead to high levels of estrogen, which is a well-known risk for many female cancers, but also prostate cancers in men. Why is aromatization important? It is a way for the body to maintain hormone balance. The male body normally produces about 7 milligrams of testosterone every day, 24/7. There is a very small amount of estrogen being produced in the body at the same time, and the optimal testosterone to estrogen ratio in a man should be maintained at all times. What is interesting, and you might not know this, if testosterone therapy in men is done in the form of a testosterone injection or a daily testosterone cream or gel, the body will experience a spike in testosterone levels, which will activate an excessive aromatization process, leading to increased estrogen levels. If pellet therapy is used, which is very different, there will be an initial spike in testosterone levels as the pellets start releasing. But as therapy in pellet form is continued, the body will no longer experience a spike in levels because pellets continue to release testosterone at a steady rate for months at a time due to the fact that they're bioavailable and their bioavailability is dictated by the heart rate. The key to avoiding a spike in aromatase levels is avoiding a spike in testosterone levels. The amount of estrogen that is aromatized from testosterone also comes down to how much enzyme a man has in its tissues, and there could be significant genetic differences between bodies. Keep in mind, aromatase levels increase with age. And what other thing happens as men age? Well, there's a decrease in testosterone levels. So men have more aromatase and less testosterone. So that's pretty dangerous, as now testosterone is low and more of it will be converted to estrogen. Aromatase levels increase with the amount of fat tissue present around the midsection. So obese men have much higher aromatization rates. So we talked about the diet, obesity, excess fat. Clearly, those would increase the aromatization process and create more estrogen in men. What about other factors? High stress, poor sleep, lack of exercise. All of these can increase aromatase levels. So what does a man need to do about this? What kind of diet should a man follow? What foods does a man need to avoid? Well, number one enemy for everyone, even though it tastes so good and it makes you feel so good, is alcohol. Ethanol directly increases aromatase activity. Number two, which again tastes real good, foods like beef and lamb, especially when grilled, barbecued, smoked meat and fish. Smoked is not good. It's not healthy. Foods like tofu, edamame, miso, and tempeh will contain soy, and this can increase aromatase activity and estrogen levels in men. So in summary, the aromatase enzyme exists in nature for a specific purpose. It is crucial during the process of sex organ formation and to maintain a healthy balance between testosterone and estrogen, whether it's a female body or a male body. So other things that we can do naturally to keep the aromatization of testosterone to estrogen in optimal range. Of course, the consumption of certain foods has proven to inhibit aromatization naturally. Celery, cruciferous vegetables, which is broccoli, cauliflower, Brussels sprouts, cabbage, etc. Other vegetables like carrots, spinach, grapes, white mushroom, parsley, and olive oil are great foods that inhibit aromatization. Fermented veggies like sauerkraut and kimchi, or fermented drinks like apple cider vinegar are also aromatase inhibiting foods and can help detoxify from estrogen. Some natural compounds called flavones are very potent aromatase inhibitors. The best we know is chrysin, found in passion flower. And there's another flavone found in chamomile. Passion flower and chamomile are usually in teas used for healthy sleep, but they have powerful anti-estrogenic properties. So keep that in mind. There are many herbs like oregano, thyme, rosemary, sage, turmeric that promote and support liver detoxification, so they can help lower estrogen levels in men. The foods like garlic, onion, and chives are rich in sulfur and quercetin, a powerful antioxidant. And together they support detoxification at the liver level and help reduce estrogen production. You might have heard of using aromatase inhibitors, medication, not natural products, as an adjunct to testosterone therapy. So make sure you ask your doctor about these medications. But first of all, ask your doctor to check your estradiol levels if you're a man and you use testosterone therapy, especially if you're a man that doesn't use testosterone therapy, but you are suffering from being overweight, have possibly erectile dysfunction, so you likely have low testosterone. You're much more likely to have estrogen levels that are higher. Keep in mind, estrogen is important for men, and it's not all about avoiding estrogen. Estrogen plays a large part in regulating mood and specifically promoting a good mood in men. Estrogen increases release of serotonin and endorphins that are feel-good neurotransmitters. If a man has very small amounts of normal circulating estrogen, they can expect to have a functional erection. But if estrogen and testosterone are both low, then it's more likely that men will experience erectile dysfunction. So low estrogen could be bad for the erection. High estrogen, it's also bad for the erection. So a small amount of estrogen, it's important for overall men's sexual health. Estrogen also plays a role in the production of sperm. But too much estrogen present in the testicles will definitely decrease fertility. Estrogen is very important for sex drive, especially in women, and is known that low estrogen in women cause low sex drive. But it is also important in men. Estrogen receptors are abundant in the brain areas related to male arousal. But high estrogen in men can have the bad effect of causing low sex drive. I will stop here as I probably gave you a lot of information. There's much more to say about estrogen, and there's more to come in the next episodes. This is indeed a master hormone. So when I pick a subject and talk about it, if it's a woman or a man, hormones might also be involved. If it's a weight situation that we're going to talk about, if it's weight loss, weight gain, if it's poor sleep, if it's other health issues, keep in mind, we might keep coming back to hormones. Estrogen is one of our master hormones and is very important. So please stay tuned for more in the future. I'll say goodbye for now. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.